D stands for?
Doctor of Physical Therapy.
Okay, Doctor of Physical Therapy. I made the acquaintance of Amanda about a year ago when, after 3 months of pretty serious pain with my knee, I happened to mention it to my physician, and he said, well, before you do the MRI and all that stuff, why don't we try physical therapy? I am living testimony, no surgery, and I'm walking without pain. So while she was working on me, my mind was going on about wellness classes, and I said, would you mind doing one of our classes for us? So she didn't, and here she is, and I'll let you get started. Thank you for coming.
Thanks for having me. As Kay said, my name is Amanda Langford. I am a physical therapist with Results Physiotherapy here in Hendersonville. Just a little information about myself. I went to Belmont University for physical therapy school, and I do have a doctor of physical therapy. Most programs in the state of Tennessee and throughout the nation are all doctorate programs now. It's just a clinical doctorate. We spend a little bit more time in the clinic doing work and also able to kind of evaluate patients so that we can see them on the just walking off the street if they have problems. We are a little bit more educated on finding red flags if we feel that if they haven't seen a doctor and we feel like they need to. So it's just a little bit more of a clinical training with that. I've been with Results for 7 years here, mainly in Hendersonville, and I am the lead therapist in that clinic. In our clinic, and myself including, we treat just about anything, and I'm going to highlight a few of those things today during the talk. But I also have a specialty in pelvic floor dysfunction, which I'll mention just a little bit of as we go along. And I am also in the process of getting an advanced training in manual therapy treatments, and all of our therapists kind of go through that training as well. And we'll mention that a lot throughout the treatment as well. There we go. So what is physical therapy? First of all, has anyone had experience with physical therapy in the room? Show of hands. All right. I hope it was pleasant. I know. I expected to get a laugh out of that because we have patients all the time come in and we get called a lot of things. I have been called a physical terrorist. I have a patient who calls me the princess of pain. So sometimes we get kind of a negative connotation to what we do. But a lot of times patients usually walk out of there having a pretty positive experience. And that's what we want. We kind of just laugh off the negative comments for a while and hope we get you better in the end. So just a definition kind of what physical therapy is. It's the treatment of disease, injury, or deformity by physical methods rather than drugs or surgery. So those physical methods may be things such as hands-on treatment, manual techniques, maybe exercise, things like that, instead of you taking drugs repeatedly and forever for something or having to have surgery for something. It's performed by highly educated, licensed healthcare professionals who've had a lot of training in evaluating and treating any kind of musculoskeletal disorder. And when I say musculoskeletal, I mean if there's some kind of dysfunction or problem in any muscle throughout your body or any joint throughout your body. And that's just about any joint. So we'll kind of touch on some of those things. And something that kind of sets particularly myself and the company that I work for, is we do a lot of hands-on treatment. And so a lot of times people think about physical therapy as just exercise. Is that what some of you kind of think about? I go to physical therapy and they're just going to give me some exercises and that's what's going to make me better. But a lot of times, and what I find personally, is that doing some hands-on treatment really makes a world of difference. And there's a lot of research behind that. And so that's something that we do a little differently where I work, is that we are always going to put our hands on you and do something to help your pain, whether it's soft tissue work, whether it's joint mobilizations. We find that doing something to calm that pain down makes things advance so much quicker, and it enables you to do things like exercise to strengthen and stabilize around that joint, because no one wants to do an exercise if you hurt while you're doing it, right? No one wants to do that. And so what we want to do is try to calm that tissue down and then work into doing those exercises. So why physical therapy? Why would you do that instead of going the easy route and taking a medication to kind of mask the pain, or just having that surgery. And I find that a lot of times these days people want conservative treatment. They don't want to have to take a pill forever. They're scared of surgery for a reason, and they just want something that's a little bit more conservative. That's very popular these days. And physical therapy is a very conservative way to treat a problem. So we're there to help reduce the pain. We want to make that pain go away. We want to improve and restore mobility and your fitness level. Making daily tasks and activities easier. We are going to focus a lot on function when you come in. If you say, I can't get up and down the stairs, well, that's going to be my goal for you. I want you to be able to get up and down the stairs. So we're going to really ask you questions to see what you are limited in, and make your exercises and your treatment more functional for you. And of course, the last thing is it helps you avoid surgery. Just like Kay said, she didn't have to have surgery, and we were able to take care of her issue with just the treatment we did and the exercises that we gave her, and she's been able to maintain that. So this is definitely a way to kind of avoid that surgery, or avoid that long-term use of having to use pain medication or muscle relaxers, and then you don't have to deal with the side effects of taking that medication forever. So just kind of what I want you to kind of get out of today's talk is I want you to just develop a better understanding of what we as physical therapists can do, what kind of services we can provide, and also understand a little bit of the causes for different musculoskeletal issues and how we would assess them and treat them. And I'm going to highlight some of the more common problems. Feel free, if you do have any questions while I'm talking, raise your hand and we'll address that. At the end, I'll just touch on some things, just mentioning on other things you might not think about that we can treat, but I kind of focused on three main ones that seem to be some of the most common things that we have patients come in for. And then we'll have some time for questions at the end if you have something specific about a particular problem that you may have. So low back pain. I will say that low back pain is the most common thing that we treat in our clinic. And I have some stats up there that I'll just run through real quickly, but 65 to 80% of people experience low back pain at least sometime, and that's a huge amount of people. After the common cold, it is the second most common thing that people go to see their doctor for, is low back pain. 90% of those cases will sometimes resolve by themselves between 2 to 4 weeks. But I think the next stat is really astounding, that 60 to 80% of those end up returning within the same year. And so that's where we kind of come in, to where we can go in and speed up that process. So it's not the 2 to 4 weeks. We can speed that process up, especially the quicker you get in, the quicker we can get you better. But also we can find the cause for that low back pain. We can treat that cause, and then we can give you things to do to keep it from coming back. And so you're not in part of that statistic where 60 to 80% it's going to come back with you later on in the year. A lot of the new research is showing that some of that hands-on treatment that I talked about previously is really effective in treating this condition, more so than just medication or injections and things like that. Is really kind of honing in, finding the culprit through some things I'll talk about in a minute, and treating that within the clinic. And if PT is started within the first 30 days, and the stats are even better if it's within the first 2 weeks of the injury, there's a significant decrease in the likelihood of surgeries, injections, long-term use of medications, advanced imaging, which is like having an MRI or a CAT scan, and additional physician visits. So there's a lot of research behind it being more cost-effective to come to physical therapy than to go the route of the more expensive things like MRI and injections and surgery. So low back pain symptoms can vary from patient to patient, but I just kind of put some general things. Your pain may be located in the low back. You may have pain into the hips as well, in the sacroiliac joints, and that's kind of where your spine and your hip bones kind of come together in the back. You may have pain that radiates down your leg. I know you've all probably heard of sciatica type symptoms. That can kind of be lumped into back pain as well. A lot of times sciatica pain is originally coming from the back. You have some kind of joint or a disc and nerve root issue that's inflamed and irritated, and that's what causes that pain to kind of shoot down your leg. You may have numbness and tingling present in the legs. Sometimes you don't, sometimes you do. And it may increase or decrease with certain motions or positions. And that may be when you bend forward to pick something up, if you twist. Sometimes sitting for periods of time, people don't tolerate that. They don't tolerate standing or walking, like they can't walk through Walmart for 15 minutes and they've got to sit down, or they're dependent upon the cart to put their weight through the cart. Bending forward, standing, all of that. So everyone's a little different. Sometimes it's leaning backwards that kind of brings on that pain. And so we kind of piece through that with our questioning and with our assessment, because it can be different things that are causing or reasons why you're having certain pain with certain positions. So the causes of low back pain. Most of the time when patients come in to see us, they have some really stiff joints and tight muscles in the lumbar area, which is your low back, but also can be in the upper back as well, kind of in between your shoulder blades, and along that sacroiliac joint that I talked about before, kind of right in that hip area. Disc issues, so you have disc, and I meant to bring my spine, but I forgot, but you have disc that are fluid filled in between the vertebra and your back. Over time, just as we get older and gravity constantly pulling on our body, those discs kind of get thinner and thinner, and they provide a space between the vertebra where your nerve roots come out from your spine, and those nerve roots are what innervate in your low back, your muscles in your legs, and give you sensation. So if your disc gets thinner and thinner over time, just in general wear and tear, that space gets smaller and smaller, and you can have some impingement on that nerve, which can cause pain down your legs. Or you might have, people have probably heard of a bulging disc or a herniated disc, things like that. That would be what would be considered disc issues. And then a lot of times these people have really poor core stability, which means they're really weak in their abdominal muscles and some very fine muscles in your low back, kind of that lie really close to your spine, and also in their hip. And I'm not talking like six-pack abs weakness, but you have some really deep abdominal muscles that are considered your core. And you may have heard of things called your core. It's kind of like a cylinder. You have abdominal muscle in the front, some back muscles in the back. You have your pelvic floor from the bottom, and your diaphragm, which helps you breathe on the top. And that cylinder just provides stability to your spine that prevents you from having pain and issues. So when you come in for low back pain, we're going to just ask you a lot of questions about where the pain is, what are your symptoms like, what kind of things make your pain worse, and then we're going to assess your range of motion. That's a picture of one of our therapists just assessing the movement of bending forward, but we're going to check all that range of motion, your reflexes, your sensation, especially if you're having like numbness and tingling in your legs, and then also things like your gait, which is your walking pattern. Do you have a limp? Can you walk well? Is it painful when you're walking? And then we'll also kind of have you lay on your stomach or back or side, and we'll just feel through a lot of that, your hip and low back muscles. We want to see if anything feels tight. A lot of the times, even if people aren't having pain in their hips, when they have low back pain, those buttock muscles are very tight as well. And then we'll feel through the joints to just assess if anything feels stiff or if it's pretty mobile. Now, when we're kind of pushing, and we'll kind of move up and down on those individual joints, there should be some give to that. When people have low back pain, a lot of times it's just really hard for us to push through that. And so we'll do things like joint mobilizations to try to loosen that up, and that in turn kind of frees up your motion a little bit more, allows you to move better, and helps with that pain too. That kind of goes into my slide here with the treatment with the low back pain. So hands-on treatment, mentioned just a little bit about that just then, about the joint mobilizations, but we also will do soft tissue work to low back muscles, hip muscles. everyone likes the word massage, so that's sometimes what I'll tell patients is we'll do a little deep tissue work or massage to those muscles to try to loosen that up and help your pain. So we'll do all those kinds of joint techniques and muscle techniques to whatever is limited. So as I mentioned before, it may be just your low back, it may be your hips as well, or upper back too. And then as we're loosening things up, calming down the pain, we'll get into some core strengthening and hip strengthening exercises, and also some stretches to help you maintain that as well. The picture here is just a picture of a type of mobilization, kind of rotational technique that we might do to kind of help open up the joints and loosen that a little bit as well, just to kind of give you a little picture of what that is. But we also can do some taping techniques. We use some rigid tape that kind of forming an X across your low back, it kind of cues you to sit or stand in better posture. It provides you some external support, but it also cues you not to slouch, because we all want to slouch, especially if we sit a lot, right? And so that a lot of times is very helpful for patients. It's something you can wear for a couple of days. You can shower in it, and it provides you a little external support, especially in the beginning, to kind of calm things down and then allow us to work through it and work through some strengthening aspects too. And then, of course, if you've ever had physical therapy, you may have used like ultrasound or electrical stimulation, like a TENS unit. We have those as well that we can use to kind of calm down the pain too. So the next topic I just wanted to touch on is something that I don't think people think about physical therapy for, and that